Welcome to the Volunteers of America and HCA Healthcare Foundation Speaker Series. I'm Rita Brock, Senior Vice President for Moral Injury Programs at Volunteers of America. This webinar today is our fourth event in a series that have explored moral distress and moral injury among first responders. In the previous webinars, we examined the causes of moral distress and moral injury, as well as strategies we have available to alleviate them so first responders can still do their vital work. We're going to post the link in the chat in case you'd like to look at the other three webinars that we've had. We've heard from the firefighter community, emergency room personnel, members of law enforcement, and advocates, all working to raise awareness and accessibility to programs and strategies that benefit first responders and support their well-being. Today, our conversation will begin inspired by Conrad Weaver's powerful new film, PTSD 911. We will all get to see a trailer, but first, I want to introduce you to our panel moderator, Delia Gonçalves. Delia is an award-winning journalist, anchor, and reporter at WUSA 9 here in Washington, D.C., and she has dedicated her career to elevating stories that make our communities stronger. We are honored and delighted to have her guide our discussion today. Delia, welcome.
Thank you, Rita. I really appreciate the intro. It's so wonderful to see you. I interviewed you about a year ago, right before school started, and so I'm anxious to reconnect with you and really have a vibrant discussion on what is a very important topic and a very critical one for so many of our neighbors. Today, building off the previous events that you mentioned and inspired by Conrad's new film, we want to take a closer look at the similarities and differences between moral injury and post-traumatic stress disorder, and the importance of understanding the hidden impacts on first responders and their families. We're also going to explore how first responder agency leadership can play a more active role in supporting the nation's firefighters, police, EMS, dispatchers, and other law enforcement and emergency department personnel. Now, as Rita mentioned, we want to show you the trailer for the amazing film that is helping raise awareness about the very issues we are all here to talk about today. And at the end of the event, we will share how you can see PTSD 911 in its entirety. Let's take a look.
I went to a really dark place in my mind where suicide became an option. I was going through a divorce. I had lost a lot of relationships with people, and I was isolating.
While I was trying to heal from the traumas that had put me in the position that I was in, I suddenly lost all the support of all the guys I worked with.
Yeah, shots fired. Shots fired on both the roof.
About 15 minutes in, I'm just listening, and all you can hear is just people screaming. I was only 2 years into my career with Boston at this point.
I was so hypervigilant, and I couldn't shut my brain off.
I remember the moment I was like, okay, I was up all night. It was just trauma after trauma after trauma. You know, the novelty of the job wore off really quick.
I couldn't think of how to get help without ruining my job.
There's a stigma in the profession that creates a barrier, a stigma in their agencies that prevents them from getting the help they need.
I didn't have somebody to talk to. I didn't have somebody that understood.
There was a part of me that said, okay, pick up the phone, call this person. This is how you're gonna get yourself out of this skillfully and safely.
I look back at that period of my life, and I just felt so completely, utterly isolated.
My ego wants to stop me from doing that. It wants to tell me, you got this. You don't need to let anybody know that this is going on.
And that's why I didn't know where to turn, and I beat myself up because I thought I am such a mess and I'm the only one.
I have 4 years till retirement, and I gotta be okay, and I gotta make it.
Right now our profession is being challenged. We're going through a really, really difficult season. There's no time like the present where officer wellness has to be your #1 priority. We have to do a better job as leadership in our profession to understand that is what we're dealing with, people. And I think it's really important that that is our #1 resource, and that it has to be our #1 priority moving forward if we want to change this profession.
We're just coming into our second year now of really teaching structured training in wellness, mental health to the Firefighter Academy. Okay, I'm open to trying something different. If you'd told me 4 years ago or 3 years ago I was doing yoga, I'd have laughed in your face. If I could plant seeds throughout the state of wellness, we'll get out there and start permeating and changing the culture.
Man, it's so much better when you have really amazing people in your life that you can walk through this stuff with. You don't have to do it alone.
Wow, that was simply incredible. So incredibly moving, and the bravery of all of those first responders to share their story. So I really want to dive into this conversation, inspired by what we just saw. We have a fantastic panel today. Joining us are award-winning documentary filmmaker Conrad Weaver, who also hosts the First Responder Wellness Podcast. We're also joined by Dr. Jonathan Sharon, founder and CEO of the Eudomia Group and a volunteer clinical professor at UCLA and USC. Jonathan previously served as the director of the LA County Department of Mental Health, that's the largest public mental health system in the US, and as chief medical officer at Volunteers of America. Bob Glover recently retired after nearly 28 years with the DC Police Department. Bob most recently served as commander. He spent 4 years as a lieutenant in MPD's homicide unit. And last but not least, Chase Bednars, an emergency medical technician and former COVID ICU patient care technician. Chase is also a VOA RsST for First Responders participant. Thank you all for being here. We're honored that you are here this afternoon to share your stories and your wisdom with our viewers on this Zoom. So let's get started. Conrad, let's begin with you. Having just watched that amazing trailer for your film, PTSD 911, tell us what compelled you first to make this film. What is PTSD and why is the message so relevant right now?
Yeah, thank you for having me. I really appreciate the opportunity to be here. So it was about 5 years ago, I was working on another film about the opioid crisis, a film called Heroin's Grip. And I was on a ride along with a police officer, and we were called to an overdose scene. And the scene wasn't something that I was familiar with or comfortable with. It was a fatal overdose. But the officers and the medics on scene were like, it's just Tuesday. And it was like no big deal. And so that got my brain thinking, okay, how do first responders deal with the traumas that they experience in the scenes that they see? And so I started doing the research, and as I studied this, I uncovered this whole issue of PTSD. And so I went back to the officer I was with, and I said, hey, is PTSD a thing with you guys? And she said, oh my goodness, if you had only knew the half of it. And then she said this, she said, if you want to make a documentary about that, I'll do anything I can to help you do that. Not realizing she would become one of the main characters and subjects in the film. And so I dove into this kind of headfirst into learning what PTSD is and how trauma and how these things affect first responders. And there's a variety of ways of how PTSD affects or how trauma affects first responders. It's a cumulative thing. It's just seeing things over and over again. You know, they say that first responders can experience 150 to 200 traumatic experiences in their career, whereas the average person may only have a couple, 3 or 5. And so those things begin to add up. And then you add those really super critical incidents that really, are perhaps if you're a cop, it's a shooting. Perhaps, you are involved in taking someone's life or someone's shooting at you. If you're a paramedic, it's an accident scene where there's young children involved in their fatalities. Those things really have a deep impact on an individual and can cause a lot of problems. And unfortunately, in the past, a lot of the training that first responders have gotten, and I've heard this from first responders themselves, is that our training was suck it up, here's a beer. And that's how they've traditionally dealt with it. And so as I learned about this, I realized, hey, no one's really talking about this at that point about 4 years ago. And so I decided to make a film about it. And that's what this film is all about.
That's amazing. When you say suck it up, here's a beer, it reminds me of an interview I did about a year ago with a Baltimore police officer who was not drinking at work, but did not pass a breathalyzer. He had suffered so much trauma over his 25 years with the Baltimore City Police Department. That was his medication. And so there is a need to talk about it. Why, just before I move on, why is it relevant now? We've been hearing from my previous reporting that there is a lot of alcoholism, unfortunately, high rate of suicide, drug addiction. Why is it relevant and important to discuss this issue now?
I think the number one thing that makes it relevant is just what happened on Monday in Los Angeles. 4 LA County deputies took their own lives. That's why this is relevant. We have too many first responders who are choosing death over life. And we need to help solve that issue and to move the needle in the right direction to say, hey, there is help available, there is hope, there is help, and offer and show where these resources are available for our first responders and make it okay to ask for help. And that's been the big problem, that it's not been okay previously.
Conrad, thank you. John, I want to move on to you. You're a longtime health and well-being consultant, having worked in this space in different capacities as a clinician, a teacher, researcher, and administrative leader. In fact, you helped develop the RsST program. In short, you've seen it all, both PTSD and moral injury. So what can you tell us about how these two concepts differ and why do those differences matter?
Well, thanks so much for having me here. It really is an honor to be talking about such an important set of topics. And I think there's a fair bit of understanding broadly about the concept of PTSD. I actually am not a big fan of that term. Like many others, including, I would say, General Corelli, I like to think about post-traumatic stress injury, as well as growth. But PTSD really, in many ways, is a reaction, a very primitive reaction to a stress, a threat that one experiences multiple times. And I would say that multiple traumas, as Conrad was saying, is really, really important in terms of developing a syndrome. But it's characterized by basically an autonomic nervous system that gets dysregulated. And really what ended up happening, we're all familiar with the concepts of fight or flight, and your fight or flight systems get turned on volume 10 on steroids, so that events that are occurring in real time can be quite threatening and quite scary, and one can experience multiple reminders or in fact re-experience things that they've had in the past. And that, as you can imagine, is very, very it's devastating to daily function. And as we point out, a lot of the ways that people deal with it is by numbing themselves and that response through intoxication. And we would expect that would be the case. And there are medications that are helpful. There are therapies, talk therapies that are very helpful. But post-traumatic stress in the frontline community is through the roof. And frankly, I think it's a growing problem. At some level, you can think about PTSD as an adaptation and in many ways a maladaptive response to a threatening environment that one can't, again, interpret. On the other hand, moral injury is, at least as I see it, an injury that challenges one's values, one's meaning, one's conscience. And sometimes those things that trigger post-traumatic stress will trigger moral injury. But when someone does something that is totally unfitting with their beliefs and their background, or they witness something, or they don't act when they see something happening that really challenges, in many ways, kind of fractures their belief system, they can become morally injured. And the thing about moral injury, and I've felt this for a long, long time, and it really relates to a lot of the work I've done with veterans in particular, is that moral injury, another way to think of it in a colloquial way would be existential crisis, leads to isolation. And that other, what I call the other LOL, the lethality of loneliness. So when people become isolated, they can start to think about taking their own lives. They can also, because things don't make sense and the world seems so hectic and unpredictable, that they can lash out. And we have to recognize that moral injury is a distinct entity. It's almost a complementary part to post-traumatic stress, and elevated. And I've done that in my career with Volunteers of America, in the VA, in LA County. I'm aware of the loss of lives, first responders here in LA, and I worked closely with the Sheriff's Department, and in fact brought a lot of treatment and care around moral injury, particularly peer-based services, to law enforcement, as well as other hospital frontline workers. But this is a phenomenon that needs to be elevated. Volunteers of America needs to be applauded and lifted and really supported to get the message out, to develop and expand the programming that is available for those who are suffering. And I could go on, I'll stop there, but you did mention something earlier, which is the time. Well, the time right now is unbelievably fragile. All of our meaning systems are being threatened, through the internet, through social media, through the wars that are erupting, through situations related to structural racism, to the climate change challenges that make particularly young people worry about the future and their ability to function and have families. It's something that we've all been brought up to understand as an opportunity and something to celebrate. Thank you very much for having me here.
Well thoughtful responses. I was thinking about the loneliness factor that you said that can be lethal. And that young lady in the trailer said she thought she was the only one. Right? She thought she was a failure and she was the only one. So having conversations like this, elevating this message is the first way to combat that type of loneliness. John, I want to hear from you. Actually, before we go to John, we go back to John. Let's go to Bob. I'm so sorry. Bob, as a long-time law enforcement officer and leader, you've not only experienced firsthand how the day-to-day work affects police officers today, but you've also carried the responsibility of leading other officers through challenging times. After almost 30 years in law enforcement, you've had some time to reflect. Tell us about what you and your officers experienced and how did you handle it all?
Well, first, thanks for having me as part of the distinguished panel. I can't stress enough what the other colleagues have said, that this is a critical time for first responders and critical time in society for the first response community. I've had a lot of time to reflect personally. January 6th was very impactful for me. I was the incident commander for the Metropolitan Police Department on the West Front. And we talk about moral injury. And one of the things that I still deal with and struggle with is not being able to care for the injured officers. We took a lot of injuries very quickly. Our system at the time We did not embed paramedics with our teams. Thankfully, our mutual aid resources from the surrounding jurisdictions had some medics that were trained up that came in and helped. And our DC Fire and EMS partners ultimately took care of us, but it was a struggle and it's something that I have to deal with. But January 6th was just kind of like the tip of the iceberg. It had been building up through the summer of unrest of May of 2020, going back to the murder of George Floyd. And, that's in addition, and they've said it's cumulative. So you take that piece of my special operations career and leadership, you couple that into serving in homicide in the nation's capital for 4 years. You see inhumanity every single day. And it took a toll on me personally. Lost a marriage, had some unhealthy coping mechanisms. And as an official, I've had 2 officer suicides that I've had to process and handle within our own agency. So it's been quite the experience. I think as a leader, we have to emphasize it's okay not to be okay, and it's okay to ask for help. And with that, any programming that's available to a first responder is policy driven. If agencies don't have policies, I would encourage leadership to institute policies. MPD had an excellent policy where critical incidents required certain number of attendants at the Employee Assistance Program, which was an independent contract program. Confidentiality was maintained except where legal requirements required otherwise. And then the department really expanded after January 6th, therapy dog program. We brought in a wellness coordinator. And more importantly, we start changing our recruit training programs and started it from in the recruit process through the academy, and hopefully build healthy mechanisms in place and policy and give the younger generation a fighting chance to deal with all this.
Rob, I'm so sorry that you had to deal with that trauma and the loss of your colleagues. Covering January 6th, the unrest that happened throughout the summer of 2020. Myself as a reporter, I understand from a different perspective. And now the city is dealing with a surging crime rate. I think as a result of the pandemic and so many other factors. And so it's a difficult time, not only for officers around the nation, but for those in our nation's capital as well. Thank you so much. Chase, I want to hear your perspective. You're an EMT. You've got COVID ICU experience under your belt, and you're headed to medical school. Like many of us, you Googled moral injury likely to learn what it is and how it might be affecting your life. So you've now taken part in RsST for first responders, the program conceived by Dr. Brock and supported by the HCA Healthcare Foundation. How did that one Google search for moral injury shift your approach to your own well-being and eventually lead you to the RsST program?
Thank you so much for having me on this amazing panel. I'm very grateful and honored to be here. So I first learned about moral injury after a Google search, as you mentioned, at the start of 2022. I was trying to process what I had seen in COVID ICUs in Chicago in 2020 and in 2021, when I was 23 and 24 years old and right out of college, working in critical care for the first time and also working in an emergency department for the first time. The majority of our work was COVID. Our ICU reverted to a normal neuro ICU for about 2 months before the Delta variant, and then we returned to full COVID ICU until 2022. I think the most impactful thing for me that caused me to look up what moral injury was in the first place was witnessing so many of my mentors and seniors in emergency services and in critical care as they struggled with burnout over the acute phase of the pandemic. I would say about half of everybody I worked with left critical care or hospital medicine during the pandemic. For me, that drove home that I have to take a proactive approach to my own well-being if I want to continue in this work, because I do really love this work. I love being a first responder, and I love critical care, and I hope to pursue that in the future as an ICU physician. So I looked up moral injury after hearing the term. I think through a colleague mentioning it at work that they had read something similar. The first resource that I found was the Shea Moral Injury Center's own resources, which sponsors and runs RsST for First Responders. And I was amazed when I was reading them, reading the resources, to find a perfect description of the exact challenges that I'd faced every day at work. And I think so many of my colleagues had too. In particular, the description of moral injury as arising from life or death conditions where doing the right thing is impossible and doing nothing feels terrible is what resonated deeply with me. And that was the case when we ran out of resources such as oxygen tubing or dialysis machines that hadn't been anticipated in our search plans, but had potentially a tremendous effect on who was able to make it out of the hospital while we were still doing our absolute best to care for them. Reading about RsST for First Responders, I gained confidence that this was a sort of this was the environment I could actually talk about these experiences with others in. And I truly believe that the approach that RsST takes in providing a place for us to talk without reservations or judgment, or even interpreting our reactions to whatever has gone on, has helped me approach my own well-being in a more proactive way. And I hope to continue participating.
I recall when I had interviewed another officer, and I should mention that I visited Harbor of Grace in Maryland about a year ago. So it's a recovery wellness center for first responders as well. And I spoke to a local officer who said, I didn't want to talk to my wife. I didn't want to talk to my siblings. I bottled it all up. And when I was finally in a space where I could, without judgment, talk about my day and talk about my experiences. Do you believe, Chase, that having that safe space where you can vent helped your healing?
Oh, absolutely, I do. I think it's wonderful how this is also a nationwide program, and it's very easy to join remotely, so that you're able to pretty much instantly be in community with first responders from around the country who are going through similar experiences to you, without you worrying that you are putting on any kind of burden on your coworkers by talking about it at work, even though that can also be like a maladaptive mindset. Yeah, I think that it's just a tremendous format to actually be able to have this kind of conversation in a judgment-free zone, and I think it absolutely is helpful.
All right, so I'm going to circle back to John now. Your reaction to what Bob and Chase have shared today. Having heard their stories and many others through your work, here's a question: is it possible to have PTSD and moral injury?
Well, thanks for that question, and I really appreciate the courage it takes for you all to share your stories with us, and they're very instructive. I find that I learn more and think more when I hear firsthand what's going on, with people who have experienced these these challenges. And the answer would be absolutely yes. And part of the problem that I was running into as I had said earlier, when I was working at the VA, I worked at both the Los Angeles VA as well as the Miami VA, and at a number of different capacities, is that there were veterans who clearly had post-traumatic stress disorder. I'm just going to say post-traumatic stress because I do not like that term at all. But who really were not making progress. And the things that they would talk about that were so distressing were the challenges to their, what we would in the field call their psychic framework, their understanding of the world and what's right and what's wrong and why things don't make sense. And how could they be? Because it's they've been so violated in terms of the meaning and the values that they've developed over time. And that, more kind of chronic type of challenge, as you can imagine, is very threatening at an existential level, which is why I to this day, and I think the literature is bearing it out, believe that the primary driver of suicide, of self-injury, is really, moral injury that's driving isolation. And I don't think we've realized that in the past. And I think we need to. And, one of the, I had mentioned before, working with law enforcement, with the sheriff in particular, but also with the fire department, as well as, emergency department folks and a lot of different frontline providers, and the ability to talk with individuals who have gone through similar scenarios, things that are relatable, and manage to come up with an understanding that is newly developed. In other words, you can imagine that when you fracture your meaning system, you have to develop a new one. And getting help from someone who has done that is absolutely critical. And the work I was doing at Volunteers of America before I met Rita was pushing battle buddy programs, leveraging the military community, the brothers and the sisters, to go out and help each other in the streets, because there's that shared experience of being a part of a community and a part of a team. And, through the many conversations with Rita and other folks, we realized the power of peers in really pushing this work. And I think that's why this RsST program is so promising. It's so impactful. And Chase, when I hear you talk about it the way that you do, I can't tell you how much that means. You spend so much time in this field trying to develop programs and trying to help people. And it's only when you hear it firsthand like that it makes you really, really appreciate the work, because it's very, very difficult. It's so difficult to get the programs, the principals together to find funding. We worked so hard to get the funding. So that program, in my opinion, is one of probably a handful or maybe more that we're going to see start to expand and take on the mental health and well-being challenges of individuals, and particularly first responders, who are suffering from moral injury. And I'm so proud to be a part of it.
Thank you. It's almost critical for the future of these industries and of policing and of medical care, everyone on the front lines. If we don't take care of ourselves and address this moral injury moving forward, there may not be many who want.
I think we lost your audio, Julia. Am I the only one?
No, she's muted.
Yeah,
I'm sorry about that.
There you go.
Okay, I'm back.
We missed the end of your brilliant comments.
It was brilliant. I can't believe you didn't hear me. It was so good. It was so eloquent. Man, too bad. All right. Well, we're going to move on. I'm going to head over to Bob now. And we didn't congratulate you on your service and your retirement. After almost 30 years in law enforcement, you're now retired. You've had some time to reflect, looking back at your journey and looking ahead to the careers of younger first responders like Chase. What needs to change, and what words of wisdom do you have for first responder leadership?
I think looking back over my journey, I was fortunate that MPD is a larger jurisdiction, and larger jurisdictions kind of benefit from a bigger budget and more capabilities in-house, right? So there's a benefit to that. And you get into your medium-sized agencies and smaller agencies, which 80% of law enforcement in the United States is small agencies, 60 or fewer officers. But as a young first responder, I think, one, to make that step into a career that can be very rewarding, challenging, at times, I applaud them. There's not a whole lot of people knocking on doors to become law enforcement right now, and that's just because societal changes. I kind of digress on that a little bit, but focusing on leadership, you have to do walk around leadership. You can't sit in the ivory tower in the puzzle palace and not know what's going on. You have to encourage your command staff and empower the command staff to be aware of the personnel. Personnel makes up normally 80% to 85% of your budget. That's your largest investment for any agency, whether it be fire department, law enforcement, hospital systems. That's a huge investment. You have to protect that investment. And that's just not shielding from liability and risk management. That's taking care of the person that's filling that role. Policy development, making it mandatory after critical incidents that you have to meet with somebody. From that, you get a lot of resistance. And I kind of came on there in the early 90s where we had some old school folks. And it was, hey, here, take the beer type thing. But, I was very fortunate after my first fatal shooting that I was involved in. I had to go to EAP, and I kept that going through my career. I didn't go often enough. I should have. But I've also, I've seen our command staff as I went up from sergeant, lieutenant, captain, and into the command staff. You have to look at scenes. You have to look at how people are reacting, or more importantly, not reacting. And then more importantly, go back to the station and bring everybody together for a debrief. And out of that debrief, you can present them with, hey, don't forget you have 5 visits you have to go to. And it's a general reminder. And then sometimes you have to pull the card, I'm sending you. And don't forget families. You hang up the uniform in your locker at work, at the station, wherever that is, but you're taking that home. And don't forget about the families. There needs to be programs for families and spouses and kids, because that's just going to continue the cycle. So again, I think you have to look at it holistically. And I think chiefs have to recognize, or any leadership, and you have to get the word out. And I have 2 very good friends of mine that travel on this and present in their own programmatic set. It's okay not to be okay. And I think we have to keep pushing that message. It's something that I believe in. I'm thankful that I've been exposed to the VOA now and this program. You've got my full attention, and I will do everything I can to help further this goal of saving a life. And that's ultimately what it comes down to, is saving a life. Whether we call it moral injury, PTSD, it's more about saving that individual. And I think we have to get the word out. And especially if it's funded and agencies that don't have programs, I think there's a market for it. I hate to call it that. It's a business model, but it is. And getting the word out and peer-to-peer.
And it's good for business, like I mentioned before. I mean, if you don't invest on the front end, then unfortunately you will pay on the back end. Conrad, I want to bring you in. Let's get your perspective. You traveled around the country for your film. You immersed yourself in the first responder world. As soon as you got that tip, hey, do this documentary, I'll help you out, you just dove right in. What are your biggest takeaways about the role that leadership can play in all of this?
Well, my biggest takeaways are from the leaders themselves that I've had the privilege of meeting and interacting with and spending time with. It's those leaders who really understand how the job affects their people. There's a police chief in Garland, Texas, that's in our film, and he said, once I understood how that these officers coming in, and pretty soon they were gaining weight, pretty soon they were on heart meds, pretty soon they were getting a divorce, I understood that the job was affecting them. And it becomes my responsibility, he said, to make sure that I mitigate those things. And so they provide everything. So having a leader who understands that everything rises and falls on leadership, as John Maxwell so famously said. And so if there are officers who are in trouble, then the leaders need to understand that and provide every resource they can to help that officer get back on their feet, get back into the job. Because just like you said, it's way more expensive to fix something on the back end than it is to prevent it on the front end. And I've seen some great examples of this. In fact, in Cal Fire out in California, a huge fire firefighting agency, they teach mental health and they teach yoga, they teach breathing techniques at the academy. We were able to film that there at the academy up in Northern California. And they have a whole program. They have 27 employees who are focused on mental health and wellness for their firefighters across the state. And that's the kind of leadership that we need in our agencies that understand this, that help develop that culture of wellness, that it's okay to talk about these things. And it's okay if you're not okay, we're going to get you help and get you back on the job, because that saves the community money. Then we have better, healthier first responders. And we all want healthier first responders because that provides a better resource for our communities and ultimately provides a healthier community.
Before we move on to Conrad, a question from the chat for John. The person who's watching asks, we're getting some questions about moral injury. Is there a diagnosis with this? And what are some treatment methodologies?
Methodologies, yeah. Well, you know, this is a for lack of a better term, condition that you know I see as a normal response. It's a part of the human condition, and there are many people. And Rita and I have been on calls with other folks who spend their lives researching and developing treatments for moral injury, trying to really in a crisp way define moral injury. You know, there are manuals that exist that have been developed in the psychiatric field that are starting to, you know, bring to, you know, a more disciplined approach to understanding moral injury, but in an appendix way, not out front. And that's a problem. There are certain types of therapies, cognitive remediation, the stuff that you know Rita's really led, that I've helped and others have helped develop, that I had kind of described before, where you're looking not just at clinicians but people with shared experience to participate and help you know redevelop systems of meaning, you know, to rebuild what has been lost and may have been, you know, put together, as I'm saying, as I've said, since childhood. So, you know, the field is it's not brand new, but it's, you know, relatively speaking, nascent. And there's a lot of work that needs to be done to understand the phenomenon, to understand perhaps subtypes, to look at different types of care and treatment modalities, some of which may apply to different subtypes. We're nowhere near that yet. But recognizing it as frankly, as an existential threat to populations who are at highest risk, including obviously first responders, is a start. You know, and that can drive policy. It can drive research dollars. It can drive, you know, organizations like the DoD and the VA, if you're just thinking about the military community, to invest in programs and screening tools, which really are not, you know, in place the way that they need to be. And that's one of the things that I'm here as a consultant working with Volunteers of America to do, is to get the VA to really up their game. I know they want to, and I know veteran suicide is a top priority. But if that's the case, then why aren't we really focusing big time on what many who have spent a lot of time in this space consider to be, you know, a major driver, if not the primary driver?
Another question for you from the chat. Lots of folks are bringing up EMDR, and some folks are talking about that, wondering if you've used that in your work, John.
Well, I'm not an EMDR certified therapist. There are many. I had many in my department who practiced EMDR, which is a very powerful tool for trauma, and has shown incredible results for PTS. The impact of EMDR on moral injury, at least as far as I know, the jury's out. And I don't know if there are any controlled trials. I don't even know, frankly, if it's been used and tested broadly. Rita, who I'd love to hear from, may have more information. I think she's probably a little bit closer to the literature than I am, and if she's available maybe and has something to say, perhaps she could also provide some feedback.
I'm not certain if Rita is unmuted and available to weigh in.
Sure, I'm happy to. I'm also not a licensed mental health therapist, so I do know what EMDR is, and I know people who've benefited greatly from it. I think because there is often so much overlap in experiences of PTSD that result in moral injury, and I think one key difference is that PTSD really has to do with the event itself and the terrorizing nature of it and the way it interferes with coherent memory and creates nightmares and flashbacks and things is an intense kind of suffering that does benefit from retrieval of memory systems and forming coherent, and EMDR is part of that process. But PTSD or PTS, whatever, overlaps with moral injury so much of the time because it's generally something devastating that causes trauma that also challenges your moral grounding. And so they cohere together. And so I think that sometimes the same things that really help a lot with trauma and PTS may also relate to moral injury in ways that can be helpful. But it's also true, and this is something I heard a psychiatrist say, that with PTS, you can have a broken memory. It's not very coherent. So if you get treated and you actually can come up with a coherent memory of a terrifying event, then sometimes that ability to have a memory kicks in your conscience and you may actually develop moral injury from the memory. So it isn't necessarily true that what works for PTSD will immediately also alleviate moral injury. It might even induce a worse kind of moral injury because moral injury is your conscience in trouble. Your conscience is now afflicting you. And so it's a kind of paradoxical thing because it means you have a healthy conscience. It means it's just you're suffering horribly because of what happened that violates your sense of conscience. And you can't make a moral judgment about something until you actually have a memory of it. So they're not the same thing, but they are often really tightly interwoven, which is one reason I think it's really important for mental health specialists to know something about moral injury. They may not want to have conversations about good and evil and faith with somebody because they're not trained to, but to be able to sort of detect maybe when somebody's really raising moral issues or faith questions or questions about their soul or the moral identity, to recognize that and realize that maybe they would benefit from talking to someone who can talk about those things, like a chaplain, or if they're religious, a clergy person. So it's so complicated. Our brain, we are as human beings are so complicated that to try to, make these little discrete things and have control over them, and then if you fix it, it'll be all right. That whole approach, I think, belies the complexity of moral suffering and psychological suffering, both together.
Yeah, if I could, I think Rita raises a really important, concept that I think is very real. PTS is characterized as I was talking about fight or flight. Flight in many ways can kind of be characterized by dissociation, and when someone dissociates, that memory is tucked away and it's not processed. And EMDR and other types of therapies, as Rita's saying, can kind of bring things into focus in a way, and that ultimately can be a part of a recovery and healing journey. But a part of that healing journey could be challenges, to meaning structures, to morality, and those would need to be processed as well. So And a part of the reason why this phenomenon hasn't been understood is because it is so deeply intertwined, you know, in the trauma universe. And while we need to do our best to dissect it and recognize that it's, you know, that it's complementary, and that it's distinct but often commingled, you know, it's important, and I think that's happening, and I think, you know, neuroscientists and behaviorists and psychologists and, you know, various other disciplines are going after a deeper understanding because it's so complicated.
Thank you, John and Rita, for weighing in. We are nearing the end of our time together. This has been a fascinating discussion, but I want to squeeze these last questions in, and we have one more question from the chat before we go our separate ways this afternoon. Chase, we've heard time and time again from first responders and from leadership that one of the biggest barriers to getting support is the stigma around needing that support. What is it about RsST that keeps bringing you back to it, and what message do you have for other first responders?
I think that's a super important question. What brings me back to RsST personally is the experience and compassion of the facilitators. So many of the facilitators, I think, that volunteer to help out with RsST have prior experiences as first responders. Some even are Vietnam veterans and have experienced the coining of the term post-traumatic stress when they were returning to the United States, maybe, and being treated in the VA initially. It's been wonderful to benefit from their wisdom, and I think one of the easiest aspects about RsST, and one of the best methods it uses to address the issue of stigma, is how it's completely unrelated to any of your work setup or situation, licensing, credentialing, or anything else that you might worry about with regard to stigma. Even people you know at work, they won't, because of how this is something that you do totally on your own time, and you can schedule RsST sessions in the morning, night, or afternoons. It's easy to join, regardless of your work schedule. I think that they do a phenomenal job at combating stigma. I also wanted to say, I think that the distinction between moral injury and post-traumatic stress with regard to memory is a really important insight, and that when at work you are in a critical incident stress debriefing, even if one is offered, or if you are in an employee assistance program sort of setting, you can't necessarily go into the whatever happened to the same depth, and there's no guarantee that whoever you are talking to actually has that experience. For myself, I actually never had a critical incident stress debriefing the entire time I worked in a COVID ICU. I remember when they occurred on my unit, I was never able to participate, though, because I was always called to participate in end-of-life care with patients when there were critical incident stress debriefings going on for other patients who had just had end-of-life care that I also participated in. So that makes it impossible sometimes in a professional setting to get any resource or help the way that RsST does offer, and I am tremendously grateful for it. I hope to be a volunteer facilitator for RsST in the future, and to see many more first responders, medical frontline personnel, chaplains, and law enforcement officers in these groups.
So, John, with that being said, if someone is looking for resources and support, is it important first to identify if they're dealing with PTS or moral injury?
Well, I mean, I think for an individual that's suffering, reaching out to get help is the first thing to do. And I would say over time, it can become clear whether, there's a primary post-traumatic stress component, or whether it's complicated by other, aspects that we're talking about today as moral injury. I just scanned really quickly through the Q&A, and I believe there's someone in the audience who's an EMDR specialist, maybe at the VA or not, who's saying that the VA has approved of EMDR for moral injury. If that's the case, I'm not aware of that, and I would really appreciate it if that if any kind of a study or paper's been written about it, if we could be shared, I'd love to read it, and I think it's important for others to be aware of it as well.
Thank you. Before we wrap up, I do have a question from the chat. We do have several healthcare providers listening in, and they want to know, what can they do to help bring this up with their leaders and their organizations? Bob, if you can take that question first, and then if we have time, perhaps Conrad can fill in.
So it's a wonderful question. The way the budget and the finances are going for pretty much every household and business right now with inflation, again, business is going to watch dollars. And I think you have to market it where, you go back and say, it's not going to cost us anything. We have volunteers. We have this program already, right? So let's start referring our folks to VOA and get them into this as a stopgap. You have a lot of volunteer clergy out there that are very educated formally, some informally, but again, I think that helps with the faith-based process of some things. And I think that for some people, that's sometimes it challenges their faith, and that's a source of moral injury for them. So again, there's a lot of things you can do that you can bring up that are no cost to an organization. And more importantly, working with human resources and developing personnel policies, they don't have to be overly complicated. Even posting signs in the break room, hey, call this number, or, hit this email, QR code, whatever that is. Society's become so easy to access things. And I think Chase hit the nail on the head. Availability to programs and being able to get into something after your shift, when you drive home, whatever that looks like for them. So I don't think it has to be overly complicated, and it can be done over a cup of coffee. Nothing challenging. And again, it's going to make them look better as a leader as well.
Conrad, do you have 30 seconds to weigh in before we wrap?
Yeah, sure. If you're a mental health provider, go get to know your first responders. Spend some time with them. Go on ride-alongs. I think having a culturally competent mental health provider is absolutely vital, because a first responder is not going to go to someone who doesn't understand their culture. And so get to know them, because it may seem scary, but you go on a ride-along, you'll really learn what these people are all about, and it'll help you better understand what they do and why they do what they do. So get to know the first responders in your community.
Ladies and gentlemen, what an amazing panel. Thank you so much. I'm going to applaud for everyone virtually in the room. Thank you so much for sharing your stories, for sharing this crucial, vital information for so many, especially the healthcare providers who are on the line, who want to reach out and offer these resources. Thank you for the real life advice and experience, and for being brave to be here. We've all learned a lot, and I thank you all. It was an honor. And on that note, this concludes our 4th speaker series. Thank you so much for joining us. And you can find out more about Conrad's film at ptsd911movie.com. And of course, his podcast, the First Responder Wellness Podcast, on Apple Podcasts or wherever podcasts are downloaded. And if you know someone who could benefit from VOA RsST, please, we urge you to visit restforfirstresponders.com. Take good care.